Welcome to Real Talk in Medicine, a podcast production of UT Physicians. I'm Shelley Vanker, and joining us today is Dr. Georgina Amaral. You are a pediatric and adolescent gynecologist here at UT Physicians. Thank you so much for joining us today.
Thank you for having me.
And we are here at our beautiful facility, UT Physicians Multi-Specialty in Bel Air. It is a very large facility, so many specialists and subspecialists here like yourself. And I want to start off with that. You are a subspecialist. And I think a lot of people may be confused or concerned when they hear adolescent and pediatric along with gynecologist. So let's start with explaining who is your patient population.
Yeah, I think that's absolutely correct. A lot of people are surprised to hear that there are some children and young people that can benefit from seeing a gynecologist. But I do think I'm very lucky. I have the pleasure of helping take care of young people from birth to age 21 for any gynecological needs, both some more common and less common conditions.
When you see newborns and when you see those real younger kids, that's for congenital anomalies, things they're born with, right?
Sure. Conditions can vary, but sometimes I do see variations in the way the reproductive system was formed, so anatomical differences. But sometimes it's also conditions like a infection involving the area of the vagina or the outside of the vagina, the vulva, and that sort of thing.
Okay. And then when you get into teens, we're talking about puberty. That's the adolescent age. Our bodies are changing. And I think that's the heart of our conversation here today.
Sure. Yes. Both in children's and adolescent age, we are typically seeing and helping families cope and manage conditions like puberty and periods, what's normal and what's abnormal, along with other things that tend to come up from time to time, things like ovarian cyst, for example, or injuries that can also happen.
Okay, so let's start with periods. You brought it up. It's a big topic. It's going to happen to almost one in every second person out there, right? Or a little more. I think there's more women than men in the U.S. So start off with at what age is the average period going to start? And when your period starts, what does that look like? Or what does that feel like? I mean, it's not going to be normal, regular right off the bat.
Yeah, I see a variation in terms of the age of the period starting, but we know across the board, age 12 is when the majority of kids are starting their first period, between 12 and 13. Sometimes we see a relationship between mothers and daughters that can be related, and sometimes we see some changes depending on if there's been any issues like other medical conditions, but typically by age 12.
Okay. And when you first start your period, or when your daughter first starts her period, talk to us about it may be incredibly irregular, right?
There can be a time frame of irregularity, particularly in the first year, in the second year. Typically by the third year, we're seeing a more typical adult pattern, but particularly in those first 2 years, a regular period really can mean something different for a young person or a teenager.
Okay. And what is not normal for a teenager when they're having their period?
Yeah. So the frequency of the periods can be a little bit more varied than our typical adult patients. So the frequency, for example, can range from 21 days to 45 days. And if you think about that in a calendar sense, with a typical period lasting less than 7 days, it may be that you're seeing a period come, for example, more than once every month, or skipping a month. But really, what's not normal is to have a period that is too long, too heavy, or too painful.
Okay, and let's talk about that. If it is long or heavy or painful, what do you do? And what is the sign that this is too long or this is too heavy?
Yeah, I think that's a really good question and important things for all teenagers and parents to kind of be aware about. For example, something like a heavy period can really affect things like school performance. If we start seeing things like anemias or iron deficiencies just from the periods being too heavy. Same thing, periods that are too painful can sometimes cause things like even nausea or vomiting and absence in schools, which of course can affect things like development and things like social growth, really important things for a lot of our teenagers. So a period is considered to be too heavy heavy. If it is too long, typically more than 8 days. Okay, so we use kind of this rule of eights. So a period that goes 8 days or more persistently can cause things like iron deficiency or anemias. If it's so heavy that it's really soaking through things like pads or tampons more often than 1 or 2 hours, or if the young person, teenager, is seeing things like large blood clots come through. Now, some blood clots can be normal, particularly if they're small, but a good point of reference would be something like a quarter size. So larger than a quarter size consistently, longer than 8 days, or having to use or change tampons or pads that are full, saturated, more than every 1 or 2 hours.
And if that happens, that's when the parent should be seeking out professional help.
Yes. That, as well as, if there's anything else going on, a history of anemias, blood transfusions, or a family history of issues with periods.
Okay, very good. You brought up missing school. Is it normal for teenagers to miss school for their period?
My greatest hope in life is that periods are not the reason that kids miss school. Typically, there are many ways we can help or intervene for this. So it is not normal for periods to be so painful or bothersome that school is missed. And there's typically something that we can do about that.
That's truly a flag, that I need to seek help. Okay, very good. When did you see your pediatrician or a subspecialist in this case? I want to be clear, you are a subspecialist. So we're very lucky to have you at UT Physicians. Explain when it is that they should be reaching out to you.
Yeah, I work very closely with a lot of our pediatricians and pediatric subspecialists. So I'm happy to see patients if they've met with their pediatrician and find that they're having issues with their periods. I'm also happy to meet with patients if they know themselves that this is an issue that's been affecting them. As a subspecialist, I am very lucky. I feel very comfortable in discussing some topics that are sometimes a little bit more sensitive, and maybe someone hasn't felt comfortable discussing this before. This is what I do all the time, so that's lucky. Mm-hmm.
A gynecologist and a counselor. And then what are symptoms of anemia and low iron?
Yeah, things to watch out for. If you're not quite sure if the period is too heavy, would be things like feeling fatigue, difficulty concentrating in school, extra tiredness, sometimes headaches, sometimes things like easy bruising, even nosebleeds, gum bleeding with toothbrushing. Those can all be signs of anemias.
And then what are the dangers of having low iron or anemia?
Yeah, the dangers can be running into things like school performance being affected and just chronic low anemia, a long-term, just a general effect on overall health.
Okay. And now let's talk through Well Women exam. A lot has changed, right? There are new recommendations. There's new guidance out there on when a young girl should have her first Well Woman exam. Talk us through what that age is now and what the recommendations are.
Sure. Yeah, I think as a group, a lot of OBGYNs are learning to be a little bit more thoughtful about why we do the exams that we do, and making sure that when those exams are performed, they are, in fact, for a good reason and have some clinical value. Typically, we recommend that young people see a gynecologist, at least for their first Well Woman exam, between the ages of 13 and 15. Now, this first visit really is about building trust, right? A foundation of trust and helping the teen come into this space of confidence, learning how to ask questions and how to understand their reproductive health overall. An exam is actually typically not required in the sense of a pelvic or a vaginal exam. And I think this is really important because a lot of times families or the young person themselves might be very nervous about coming to see the gynecologist for this reason alone. Things like vaginal exams and pelvic exams are really important for things like cervical cancer screening, okay? And that starts at age 21 for all patients. So that's regardless of sexual activity, for example, that's age 21 across the board. There are some reasons to do pelvic exams if there's a particular issue, but nowadays I think we are much more fortunate in that we don't do this routinely unless there's a good reason for it.
Okay. So I think the old thought was, oh, the moment I take my daughter to a gynecologist, that's giving her permission to begin her sexual health. But that's not what going to the gynecologist is about, right?
Correct. Particularly for this first well-woman exam, again, between the ages of 13 and 15, it's really about building an understanding of what reproductive health is as a whole. So understanding things like puberty, have those changes happened, have they occurred typically or not so typically? Are there any issues with that or any worries that the teenager might be experiencing? How's the menstruation? Is that limiting their ability to participate in things like school or the things that they want to do, making sure those things are in place. Certainly sexual health education and a conversation of contraception may be important for some patients and can certainly be accessed at that time too.
Okay. And we brought up two different exams here. We brought up the pelvic exam and the cervical cancer screening, or I should say a screening and an exam. Explain the difference and when you do one or the other.
Sure, yeah. So the PAP is something that we do for cervical cancer screening. So that involves obtaining a sample of the cells of the cervix, and that is done with the pelvic exam. There are other reasons to do a pelvic exam. For example, sometimes there are issues in the way the anatomy is formed, the hymen itself. There can be issues with discharge, sometimes injuries, and several other reasons. But that is distinctly different than the PAP itself, where we're looking for either precancer changes or just changes in the health of the cells of the cervix or the entry into the uterus specifically.
Okay, so that PAP is the cervical cancer screening that is sometimes performed during a pelvic exam.
Correct.
Got it. Okay. Let's talk about misconceptions of your first well-woman exam.
Yeah. The biggest one I run into is certainly around the idea of the pelvic exam and the vaginal exam and what that entails. So I'm really glad we got a chance to talk about that. But other misconceptions or things that may surprise some families is sometimes the duration of the visit itself. I think we do tend to spend a little bit more time. It is really important that when I meet with families, we meet as a family together first, but then also provide some space for the teen or young person to be able to ask some questions one-on-one. So we do a private interview, and that is, I think, a incredibly valuable experience in terms of building this sense of autonomy in the young person and helping them understand their reproductive health, also giving them some space and confidentiality to ask whatever questions they might have on their mind.
So it sounds like that first exam was really a talking, like it's a conversation. It's getting to know each other. It's setting the mood for, okay, reproductive health down the line.
Correct. I think that's a great way to frame it.
Okay, very good. And let's talk about cervical cancer. You just mentioned that the PAP is the cervical cancer screening. What causes cervical cancer?
Yeah. We think that the majority of cervical cancer is actually caused by a virus, the HPV virus or human papillomavirus. I think that we are very fortunate now to have a vaccine that helps protect against this virus. So while a PAP may not be part of the very first gynecological visit in a pediatric and adolescent gynecology setting, I think it is always something that we talk about in terms of preventative care. The HPV vaccine should be given to both boys and girls now between the ages of 9 and 11. And it is a series. So it involves either 2 or 3 injections total. So part of the first visit for us is making sure that the young person has had an opportunity to complete that series and help make sure that when the time for the first PAP comes, that they're best protected against anything abnormal coming up on that test.
And that's just a normal injection, like a regular vaccine in the arm.
Correct.
Right.
Yes.
And so that's recommended to start between 9 and 11, your
Yes.
first vaccine.
Yes, first injection. And if it started at that age group, there's typically only 2 injections that are necessary. Occasionally, I do meet some families or patients who have not had the opportunity to initiate the vaccine series. If we initiate the vaccine series after 15, we can do a catch-up series, and it requires 3 injections total.
And is it important to start this vaccine series or complete the vaccine series before first sexual encounter?
Yes, that is part of the benefit of the vaccine, is offering some protection in the body before the first exposure to this virus. This virus, we do know, is something that is transmitted with sex. So it's just immensely valuable to have that immune system build up before that first exposure.
I know when the vaccine first came out, there was a lot of hesitancy out there, right, in communities and populations. And have you seen that hesitancy wane during your career?
Yes, I think fortunately there's much better understanding and education around the vaccination, and I think that's fortunate for us because the idea is that we can prevent conditions like cervical cancer, and I think this is huge. We don't have vaccines out there that just prevent cancer, but this is one of them. So I think we are luckily moving in the right direction for that.
And talk to us about what cervical cancer can do if you do develop cervical cancer and the risks associated with having cervical cancer.
Yeah, so cervical cancer is a cancer, so it can start in the cervix itself, but spread to other places. So when we're doing something like a PAP, we're really looking for those pre-cancer changes that can sometimes be treated, either by removal, closer monitoring, things like that. But if it does advance, right, to become a cervical cancer, then that is a cancer like other cancers and can really, really cause some tragic outcomes.
Mm-hmm. Does it impact your reproductive health, being able to get pregnant later on, carry a child?
Yes. Conditions like cervical cancer can affect things like fertility and ability to bear children later in life. So, we talked about HPV being something something that can be sexually transmitted. It is not the only sexually transmitted infection. So I think that, like other sexually transmitted infections, can affect things like fertility and future reproductive health outcomes.
Okay, so again, to reiterate, there's a vaccine to protect women. The vaccine is for both women and men, boys and girls.
Boys and girls, correct.
Okay, let's talk about breast health. What is it that you want parents of adolescents to know as breasts start to form?
Yeah. So I think breast concerns are common, particularly around the time of puberty. There's a lot of changes that come throughout the body, but the breasts are one of them. It is very normal to have questions come up around this. Some of the more common things I run into are concerns about things like asymmetry. So one side may be looking different than the other. This is actually quite typical. So a lot of the conversations we have in our clinics are what's normal and what's abnormal. In terms of things like routine breast exams, those aren't always indicated, but can be done, particularly if there's any concerns for things like lumps or bumps or leaking from the breast. So these are all part of something that we call a breast awareness. So just general breast awareness. What's normal, what's abnormal, it really helps guide us for when we need to do something like a breast exam.
And when do you expect for an average teen to have their first breast exam in clinic?
Yeah, if there's really been no issues, we typically start doing this around age 19 or 20, unless something comes up.
Okay, so once they're an adult.
Yeah, I would say the other thing that comes up is around just breast pain. So sometimes with puberty and growing changes, there can be some pain associated. Sometimes that is related to things like hormonal changes or periods. So we do talk quite a bit about that. that and the things that are, again, normal and abnormal, and some remedies for that.
And when should we start our own at-home breast exams ourselves? At what age, what point, do they start? Do you recommend that?
Yeah, so that's also something that's evolved a little bit over time. So routine self-breast examinations have really kind of morphed into this idea of just general breast awareness. So that is something that we talk about quite a bit. And the idea is to try to minimize any unnecessary interventions. Things like biopsies and ultrasounds are sometimes more quickly done. But for young people, we know that there's actually a lot of normal changes, and the breast tissue itself can be a lot more dense. So things like lumps or bumps are typically not something that's precancerous or cancerous, or more so benign. So we do a lot of education about this.
Okay, but if you do find something or are concerned about something, have a conversation first with your pediatrician, primary care provider, gynecologist. Okay.
Yes, of course.
Okay, always, right?
Yeah.
All right, I want to move into some viewer questions, some common patient questions that you receive. First up is, my daughter hasn't started her period yet. Is that normal?
Yeah, I think that's a really important parameter to know. So what age should a child have started their period? We talked about age 12 being the most common, but if a child has gone through age 15 and we haven't seen a period, that's usually a little bit of a flag, okay? Not always an issue. Sometimes we're looking at delays, but the truth is, about 98% of teenagers have started their period by age 15. So if there is an underlying issue, around that age is when we should start investigating it.
Okay, to look for something else that's happening with their body.
Correct. There's a couple other caveats around that. If, for example, there's no puberty changes at all by age 13, that includes things like breast development or sexual hair development. By age 13, usually we start to do some investigations around that too.
Okay. Next question is, my teen has painful periods. What can I do? What can you do at home?
Yeah. This is a very common concern. So there are some remedies that can be accessed just generally at home, over the counter, and it really has to do with what the reason is for the pain, okay? Now, menstrual cramps, I think most of us have experienced that at least some point in our life if we are menstruating. Usually the first thing to do is to consider something like an anti-inflammatory. Okay, this would be like an ibuprofen or an naproxen, a medication that you can purchase at the grocery store, at the pharmacy. Doing this or something like an acetaminophen can help with the cramps. Part of the trick with that is actually doing it sooner rather than later. Cramps that progress to being very severe are actually much harder to treat once the pain has progressed to that point. There are also some other things that can sometimes help. Things like exercise, for example, right before the period has been shown to help reduce things like cramps. Yes, now if the cramps are bad enough that there's things like nausea or vomiting or, again, missing school, that's definitely a little bit of a flag and should come in for evaluation.
Okay, I've never heard that exercise strategy.
Yeah.
But I have heard the pain strategy. You got to get ahead with pain before it gets too bad, right?
Yeah, something a little bit like an avalanche. So, yeah, get ahead.
Next question is birth control safe for teens?
Yes. I see a lot of patients with a lot of different issues that need things like prescriptions for birth controls. The short answer to the question is that yes, birth control is safe for teens. What a lot of parents and families don't know as much is that we use these medications for all sorts of reasons. So sometimes medical conditions, period regulation, sometimes menstrual suppression, or helping things like polycystic ovarian syndrome, endometriosis, conditions that come along with periods sometimes. So yes, in general, birth control options are safe and accessible for teenagers, sometimes for the pregnancy prevention aspect or the birth control, sometimes for other medical reasons.
I didn't realize that there were a wide range of reasons or uses for birth control.
Yeah. Yeah, I wish we had a pill that said it was specifically for PCOS, but really we don't. So it's these similar medications that we're accessing. And, sometimes we say birth control pills. Of course, there are a wide variety of options for these hormonal therapies, sometimes in sticker or patch forms, sometimes in long-acting methods that are implanted either under the skin in the arm or inside the uterus. Lots of options for different reasons. I hear a lot of worries and concerns. There's a lot of myths out there, certainly. But I think sometimes less appreciated are some of the benefits, right? So particularly for teenagers, conditions like acne, for example, can be quite common and sometimes helped by things like medications with hormones. Again, sometimes needed for things like pregnancy prevention or birth control, sometimes for other reasons or menstrual regulation. I see other questions. We often talk about things like vulvar or vaginal hygiene.
Yeah.
Yeah. So there's so many trends out there. I feel like
talking about social media trends.
Right.
Yeah. Let's debunk those myths and the trends that you should not be doing.
Yeah. I feel like I learn of a new one almost on a weekly basis. But really that's what the pediatric adolescent gynecologist is here for. Questions that come up around these new ideas I can often be better understood with a little bit of guidance. But in short, the vagina has normal bacteria and can typically do a very good job about keeping itself healthy. So I can never do enough, public service announcements around trying to avoid things like vaginal products, douching, for example, and being mindful of how sensitive actually the vagina and the skin outside of the vagina or the vulva can be, particularly if a young person is accessing things like hair removal. So we can always talk about that.
Okay. One thing that I've seen a lot lately on the market, just in the retail world, is a trend towards organic period products, organic pads, organic tampons. Is that important? I'd never even had thought twice about that before.
Yes. Yeah. I feel like every once in a while I have to go down that aisle, right? Just to stay tuned into what is new. And the truth is we have a much wider diversity of options in terms of menstrual hygiene products, which is good. Particularly for some of my patients have special needs or developmental delay, and things like soiling clothes during the period. It can be an issue, and the variety now includes things like period underwear. There's menstrual cups. There's menstrual discs. There's a wide variety of pads, like you mentioned, and tampon products. The truth is some patients are more sensitive to certain products and can develop things like irritation around the skin if they're using one product versus the other. So if a young person starts to notice that there's issues around things like discharge or irritation around the skin on the outside of the vagina, that's typically when I consider actually taking a closer look at what products exactly they might be using, or the period itself. Like maybe it's that they're really bleeding for too many days or bleeding too heavily. Mm-hmm. Yeah, so I think that's something that we touch on quite a bit.
And is there anything that you tell a patient or patient family if they're coming to see you for the first time and they're scared, they're starting their puberty journey? What can you say to those patients and those families at home to kind of help calm them through this journey that everyone goes through, right?
Right. Most of us have the opportunity to go through puberty. So it is a little bit of a universal experience, but everybody's experience is unique. So I often remind my patients, their puberty might look different than their best friend's puberty, but they have allies. So moms and sisters are great allies during this time of transition. But I'm also certainly here happy, willing to answer any questions that they might have along the way.
That was great. Thank you so much for joining us, Dr. Amaral. If you have any other questions or concerns or any more interest in this topic, you can find us at utphysicians.com. Thank you for joining us on this episode of Real Talk in Medicine, a podcast production of UT Physicians.